Para mais um webinar. Bom dia a todos, good morning to everyone. É um prazer tê-los todos aqui, né? Mais uma inovação, né? Hoje vamos falar sobre inovação em vários sentidos, né? A professora Kostkova, né, da UCL, ela vai, né, falar um pouco, né, do que ela vem fazendo no Instituto de Redução de Risco e Desastre, né? É a nossa mulher inovadora do ano, né, pela Universidade, né, Universidade College de Londres, né? Jones vai fazer a apresentação dela posteriormente, né? A outra inovação é outra mulher, Isly Viana, né, aqui, né? Jornalista. Isly, muito obrigado por estar aqui. Bom, é a pessoa talvez mais conhecida, né? Então, ele tem um programa extraordinário na TV Jornal, né? Agora está na internet, né? E ele vai colaborar conosco aqui, né, no nosso, né, webinar do LIKA, né, nas sextas-feiras, né? Bom, o Jones Albuquerque está aqui, né? E o Miguel Nicolelis. Miguel, muito obrigado, realmente, como diria, da ponta do ventrículo esquerdo, por você estar aqui conosco, né? É uma alegria muito grande, né, tê-lo aqui. I'm going to talk a little bit, just to say thank you very much to everyone to be here. Thank Isly to going to organize this webinar for us. No, but thank you again to be here. No, well, I know the summer in UK now looks good, right? But you were here, with the ice for a while. And Miguel, thank you very much for coming. Well, I have to say, Miguel is going to leave us, by just past 11 because he's organized a meeting with the governors of Northeast, and he's a very important person in this meeting, so you have to leave. And, well, I'm going to be quiet. I'm going to pass the word to Isly. I'm going to carry on this webinar. Thank you very much to everyone. Obrigado, Miguel. Vou falar só em português, dizendo que o Miguel vai ter que sair aí depois das 11 horas, né, porque ele tem uma reunião com os governadores, né, do Norte e Nordeste. Um pouquinho mais, né? Não é isso?
Não, é um pouquinho antes, às 10h45 eu tenho que sair, mas
então pronto.
É uma outra reunião, é um debate que eu tenho que participar em nome do
debate. Entendi. Então é importantíssimo. Então, eu paro por aqui e passo para o país para nós aproveitarmos o máximo, Miguel, a tua presença aqui.
Muito obrigado.
Maravilha. Obrigada, primeiro, pelo convite, professor José Luiz, professor Jones. É um privilégio para mim estar com vocês falando sobre a pandemia desde o início, né? Tive o privilégio de receber vocês no programa de TV, na TV Clube, onde eu trabalho, e vocês ajudando a população a entender. E o meu trabalho tem sido traduzir, talvez, né, a ciência para que as pessoas de todas as classes sociais, principalmente, de todos os níveis de conhecimento, possam entender a gravidade do problema que a gente está vivendo mundialmente, né? Não só em Pernambuco. Eu estava, claro, levantando alguns números aqui das notícias, que inclusive a gente é tão criticado pelas notícias. Vocês só dão notícia ruim, só dão notícia ruim. Infelizmente, é a notícia ruim que faz com que as pessoas tomem atitudes e tenham as precauções necessárias para preservar a própria vida, né? Então, a gente aguentou e temos aguentado muito esse título, né, de mensageiros de notícias ruins, mas entendendo a importância de alertar as pessoas sobre esse assunto. To the Professor Patty, nice to meet you here with you too, so nice to talk with anyone that will listen to us in English. But, falando dos números que a gente observou aqui, aí que me chama muita atenção saber que estamos às vésperas do Brasil completar 3 milhões de casos e 100 mil mortos. É um número muito marcante, é um número que em qualquer outro episódio a gente jamais teria visto um dado como esse, um número como esse. E se a gente for comparar, por exemplo, a cidade de São Paulo a um país, eu estava fazendo essa comparação, o estado de São Paulo, na verdade, seria o 5º em número de mortos, né? Quando a gente for colocar ali o São Paulo no meio da lista de países, então a gente poderia considerar São Paulo um país, já que ele teve 24 mil mortos. É algo que eu jamais imaginei, eu nunca me imaginei como correspondente de guerra, e é de fato um número que a gente precisa destacar. E em relação a Pernambuco, eu lembro muito bem do início, de quando a gente começou a falar da pandemia e falar para as pessoas das expectativas que a gente tinha. Em Pernambuco, sempre ali entre os primeiros estados, né? Rio de Janeiro, São Paulo, Ceará e Pernambuco estava sempre ali. E hoje Pernambuco é o 10º estado no número, então eu suponho que as providências tomadas tenham sido muito importantes para fazer com que Pernambuco fosse caindo pouco a pouco nesse número, mas nem de longe a gente está numa situação confortável, né? E a gente precisa ressaltar que a nossa situação ainda não é fácil. Então, analisar esses números, especialmente com a ajuda de todos vocês, tem sido importante para transmitir isso para a população, e eu me sinto muito honrada de estar fazendo parte agora desse time junto com vocês. Obrigada pelo convite e vou continuar tentando traduzir essa ponte entre tudo de tão importante que vocês têm produzido e as pessoas, né, através de um veículo de comunicação como a televisão e como a internet também.
Obrigado, Isly. Isly, para quem não sabe, é nossa mais recente pesquisadora aqui do LIKA com a gente, de verdade. Isly tem mestrado, vai estar começando o doutorado dela, então é cenário. Eu queria começar apresentando o professor Nicolelis, que não precisa apresentação, mas eu vou tentar aqui. Sir Nicolelis, como eu chamo ele no grupo. E muito obrigado, professor, por ter topado. É um neurocientista de repercussão internacional e que topou fazer isso. Together with Patty Kostkova, that is our friend and research scientist in UCL and the Innovative Woman of the Year series. Last year, it's not easy to be this. And she is from UCL. Thank you so much. Thank you so much for joining us together to fight COVID and to help COVID. Eles dois e Isly agora são membros do IRD. Sempre foram. Então, muito obrigado, professor Nicolelis. Vou tentar responder as perguntas que forem direcionadas ao senhor no final, já que o senhor vai ter que sair um pouco mais cedo. Muito obrigado. Com a palavra, Sir Nicolelis.
Eu fui promovido agora. Muito obrigado, Jones. I have to apologize to Patty because we discussed that I should talk in Portuguese. So sorry, Patty, but it's a nice language, and I'm sure you can learn very quickly. So we can talk about it. Mas primeiramente eu queria agradecer evidentemente ao José Luiz, ao Jones, ao IRRD, ao UFRPE pelo convite. Também a Isly pela introdução e por estar aqui conosco, a Patty por participar gentilmente lá de Londres. Eu já dei algumas aulas lá na UCL, gosto muito da universidade, tenho vários grandes amigos. Mas eu queria agradecer a vocês a oportunidade e também vou até começar aqui o meu cronômetro para não perder a hora. Mas gostaria de também agradecer a todos que estão nos ouvindo, né? E eu pensei em discutir isso com o Jones quando ele me convidou, que eu queria fazer algo um pouco diferente. Eu queria conversar com vocês aqui sobre um ponto de vista que é raro ser discutido, talvez não tenha sido ainda aqui no Brasil, e talvez mesmo fora do Brasil, que é uma visão neurocientífica do que nos levou a essa pandemia. Qual foi realmente o fator desencadeante, né, real? E, na realidade, pode até parecer estranho, né, você falar como o título aqui da minha palestra, como a neurociência explica a pandemia, mas eu vou tentar mostrar para vocês um ponto de vista que eu recentemente publiquei no meu livro que saiu pela Yale University Press nos Estados Unidos, está sendo aqui no Brasil agora, no qual eu defino o cérebro como o verdadeiro criador de tudo, né? O criador de todas as nossas interpretações do universo, sejam elas as mais diversas possíveis, desde a criação dos deuses até a criação do método científico. Todas essas descrições do universo e dos fatos da nossa vida dependem disso aqui, dependem do tipo de cérebro e do tipo de neurobiologia que o processo evolutivo gerou. E, na realidade, o primeiro ponto que eu queria mostrar ou evidenciar é o fato de que essa pandemia, quando ela ocorre e ela coloca todo o planeta de joelhos em 4 meses, a primeira grande conclusão, não só minha, mas de vários pesquisadores, é que ela expôs de modo explícito, como se fosse uma fratura exposta, todas as grandes fragilidades do nosso modelo civilizatório e de desenvolvimento econômico. Quer dizer, desde a grande da ascensão do método científico, do capitalismo, da Revolução Industrial Inglesa, o modelo de desenvolvimento implantado e que basicamente se espalhou pelo mundo e dominou todo o mundo, o modelo econômico e político que nos governa, se é que eu posso dizer que existe isso, né? Uma governança global, na verdade ela não existe, mas o modelo econômico foi claramente exposto, porque, na realidade, ele coloca como prioridade o que eu gosto de chamar de abstrações mentais. Então, o que a neurociência tem a dizer aqui sobre essa pandemia, no primeiro momento, no primeiro estágio, demonstrar mais uma vez, como aconteceu em toda a história da humanidade, que abstrações criadas pela mente humana, que derivam do tipo de biologia que rege o nosso cérebro, e o nosso cérebro é extremamente... duas características importantes, aliás, três importantes do nosso cérebro. Ele é extremamente inclinado a gerar abstrações, mitos, deuses, religiões, manifestações mitológicas, ciência, arte. Primeiro, essa é a grande característica, gerar abstrações que se transformam com o tempo em algo mais importante que a própria vida humana. Então, essa é a segunda característica. As abstrações geradas pela mente humana são capazes de se espalhar rapidamente pela nossa habilidade de comunicação, tanto a natural, né, a linguagem oral, que foi uma revolução na evolução do cérebro humano, a linguagem escrita, mas mais recentemente, nas últimas centenas de anos, 200 anos, métodos tecnológicos que ampliaram dramaticamente a forma com que uma abstração criada na mente de uma pessoa, de um grupo social, pode se espalhar rapidamente e sincronizar mentes, milhões, bilhões de mentes hoje com a internet, a ponto das pessoas começarem a acreditar que essa abstração que saiu da cabeça de alguém é mais importante do que a vida das pessoas. E a terceira propriedade fundamental do cérebro é que, ao exercitar esse dom de gerar abstrações e de conseguir sincronizar cérebros com estas abstrações, usando essas abstrações como se elas fossem um vírus informacional que invade a mente das pessoas e toma conta da mente das pessoas, independente de qualquer tipo de racionalidade, o cérebro humano ele é extremamente capaz de se automodelar. É uma propriedade que nós chamamos de plasticidade. E o que ocorre com a plasticidade? Tudo que nós fazemos, cada ato da nossa vida, cada interação com o mundo exterior, a cada momento da nossa existência, retroalimenta o cérebro e modifica a configuração estrutural, microestrutural do cérebro, mudando a sua fisiologia. Então, quando você soma essas três propriedades, a propriedade de gerar abstrações, a propriedade de se comunicar rapidamente e sincronizar mentes com essas abstrações. E terceiro, a capacidade de mudar a mente humana através desse processo de comunicação e de espalhamento de abstrações que não necessariamente correspondem à realidade, ou à melhor definição da realidade que nós podemos ter, você começa a conseguir explicar como nós chegamos nesse precipício a nível global da pandemia. Pois, basicamente, ao colocar interesses econômicos acima da sobrevivência do planeta e da espécie, ao definir que crescimento, lucro e ganância são mais importantes do que saúde pública, a sobrevivência do meio ambiente e, basicamente, a interação harmoniosa e sustentável do ser humano com o seu planeta, que é o único que até o momento nós sabemos que nós podemos habitar nesse instante, nós conseguimos explicar as raízes da pandemia. Nós começamos a explicar não só o que levou a um vírus que provavelmente estava circulando em animais silvestres, muito bem, interagindo de uma maneira ótima como parasita de hospedeiros em outros mamíferos, como a invasão desses ecossistemas, por exemplo, por fins de obter lucro e crescimento econômico a qualquer custo, levou a um vírus como esse, e poderiam ter sido outros mais, e poderiam ser vírus aqui no Brasil, na África, não necessariamente precisa ser na Ásia. O desmatamento da Amazônia provavelmente vai gerar coisas parecidas, mas como essa busca incessante pelo lucro, em detrimento da segurança e da saúde pública humana, levou ao processo pelo qual esse vírus, o coronavírus, pulou de algum animal silvestre para o ser humano, se adaptou rapidamente e começou a se espalhar nós já sabemos hoje, em poucos dias, poucas semanas, pela via aeroviária internacional, para o mundo todo. Então, esse é o primeiro ponto que eu gostaria de fazer. No momento em que a nossa espécie utiliza abstrações mentais como sistemas econômicos X, como epicentro cosmológico da nossa vida diária, da nossa vida cotidiana, como o objetivo principal da existência humana, a produção de lucro, ou a produção de crescimento desenfreado, nós nos expomos a uma variedade de fragilidades. A pandemia é uma delas. No meu livro eu levantei duas outras. Uma muito pior do que a pandemia, que pouca gente fala, eu acho que talvez uma minoria pensa nisso, mas que é muito provável de ocorrer, porque nós estamos, na realidade, na janela estatística de alta probabilidade. 200 anos depois, Perry vai ficar talvez meio assustado ao saber que a Inglaterra, 200 anos atrás, passou pelo chamado Carrington Event. Carrington Event nada mais foi do que, no meio da madrugada, a noite se transformou em dia, porque o crescimento acelerado de manchas solares no nosso querido Sol levou a uma ejeção da corona solar e que definiu o chamado Carrington Event. Carrington por causa em homenagem ao astrônomo inglês que detetou o flare solar, que ao chegar e colidir com o campo magnético da Terra, deu origem a uma tempestade geomagnética que basicamente queimou a maioria dos telégrafos ingleses e gerou um clarão que acordou mineiros que estavam dormindo, né, que trabalhavam nas minas do Colorado, nos Estados Unidos, no meio da noite, como se fosse meio-dia, acordou boa parte de Londres, a Europa inteira viu esse flare, só que naquele momento a economia mundial vivia dos motores a vapor, então não houve grandes consequências. Agora imaginem vocês se esse flare ocorrer agora, ou nas próximas décadas, e tivesse uma tempestade da mesma magnitude do Carrington Event, a probabilidade é muito alta que isso aconteça nos próximos anos, nós teríamos todos os nossos brinquedinhos aqui derretendo instantaneamente, sem internet, sem televisão, sem celular, sem geladeira, sem carro, sem avião, sem tratamento de água, enfim. Essa é uma outra fragilidade exposta pelo nosso modelo de desenvolvimento, que não foi, de maneira nenhuma, pensada. Existem estudos americanos prevendo que o dano seria da ordem de dezenas de trilhões de dólares, e vários meses para se reparar o blackout que tomaria conta do planeta. Mas, enfim, esse é o primeiro ponto que eu gostaria de fazer. No momento que nós nos permitimos que abstrações humanas regem a nossa vida e o nosso modo de viver, nós nos colocamos em perigo enquanto espécie. Apesar da pandemia de coronavírus não ser um evento lá meteoro, não existe o risco aparente nesse momento de a extinção da espécie humana, ele nos move mais próximo de um evento como esse. Essa é a primeira coisa. Essa é a primeira fragilidade da mente humana que a neurociência poderia expor como explicação para nós termos chegado nesse momento onde nós estamos. A segunda é o fato de que o cérebro tem uma outra fragilidade, que é a fragilidade de aceitar esse vírus informacional, que a gente chama hoje de fake news, mas eu chamo de vírus informacional, que já havia sido descrito por um grande estudioso de mídia, o canadense Marshall McLuhan, nos anos 60, sem nenhum conhecimento neurocientífico, mas ele teve a primeira ideia de que no momento que os meios de comunicação criados pela humanidade se transformassem em entidades capazes de transferir ou transportar informação próxima à velocidade do sistema nervoso central, que nós poderíamos ter um fenômeno global, onde inverdades, o que nós chamamos hoje de fake news, se espalhariam numa velocidade tremenda e fariam com que as pessoas, porque essas fake news apelam para rotinas neurais primitivas, como o Jung já descreveu isso nos anos 30, nos anos 20 e 30, Carl Jung, o grande psiquiatra suíço, como essas fake news, elas vão diretamente, elas atingem diretamente rotinas primitivas de sobrevivência que foram selecionadas ao longo do processo de evolução para nos manterem vivos, mas que hoje, no mundo atual, são provavelmente a base de tudo aquilo que nós negamos e que tudo aquilo que nós condenamos, como os preconceitos, o racismo, o belicismo, né, a tentativa de resolver tudo na violência, resolver tudo como se nós estivéssemos numa grande briga tribal, né, que são essas rotinas primitivas, que podem levar, como eu disse, com meios de comunicação transmitindo essas informações falsas a uma velocidade impressionante, na velocidade da luz, né, levar à sincronização de milhões de mentes que passam a agir como se fossem verdadeiros zumbis. E, no meu livro, eu discuto questões, como isso influenciou a história da humanidade num tempo diferente, né? Como as guerras, os grandes genocídios da história da humanidade, que são todos antropogênicos, evidentemente, criados pelo homem, como, na realidade, na raiz desses eventos, como o genocídio de Ruanda, a Primeira Guerra Mundial, as batalhas da Primeira Guerra Mundial, eu falo muito da Batalha de Somme, no solo francês, como que o exército britânico teve as maiores perdas da sua história nessa batalha, quando os generais mandavam soldados para o No Man's Land, o campo que separava a trincheira inglesa da trincheira alemã, a trincheira inglesa e francesa, diga-se de passagem, de uma maneira insana, porque esses jovens saíam das trincheiras e eram mortos imediatamente pelo fogo cerrado das metralhadoras. Enfim, essa fragilidade do cérebro de ser vítima ou presa fácil desse vírus informacional de fake news gerou movimentos como esse ao longo da história, e no momento que a pandemia atinge o mundo, ele é responsável por uma batalha que talvez seja, como eu tinha falado para a Isly antes de começar aqui o webinar, uma das batalhas mais fundamentais desse momento, que é a batalha da comunicação. Porque no momento que a pandemia começa, várias camadas de fake news começam a ser espalhadas pelas redes sociais de uma maneira como se fosse uma avalanche informacional, e devido à fragilidade do cérebro humano em aceitar essas fake news, esses vírus informacionais, porque eles vão direto na porção irracional do nosso cérebro e fazem com que essas rotinas neurais armazenadas há milênios emerjam e tomem conta e passem por cima da racionalidade que é definida pelo córtex aqui em cima, e façam com que as pessoas comecem a agir verdadeiramente como zumbis. Essas fake news não só criaram essa sincronização de milhões de mentes para aceitar a proposição que drogas que não funcionam deveriam ser usadas como prioridade, que era só uma gripezinha, que nós não tínhamos que nos preocupar, que realmente isso daí nem existia, ou era uma coisa feita em laboratório, uma conspiração para destruir o mundo capitalista, enfim, uma série de fake news conseguiram influenciar um tal número de mentes que hoje, tristemente, no Brasil, nós estamos chegando, apesar que o número já ocorreu, como o Jones já me contou, e nós já sabemos disso, esse número já ocorreu dias atrás, mas hoje, oficialmente, provavelmente, à noite, nós cruzaremos a marca inacreditável de 100 mil brasileiros e brasileiras mortos em, basicamente, menos de 6 meses de uma pandemia viral. Quem poderia acreditar nisso em dezembro de 2019? Se a gente falasse, quando as notícias da China começaram a chegar, e nós começamos a ver em janeiro a população de Wuhan entrando em lockdown. A propósito, eles já saíram, a China já resolveu, basicamente, por enquanto, pelo menos, o problema a ponto da vida estar se normalizando. Eu me pergunto, quem imaginaria que nós estaríamos aqui hoje, no 7 de agosto de 2020, falando da maior perda de vidas da história do Brasil, se nós não considerarmos o genocídio indígena do século XVI e XVII, dos colonizadores europeus, né, que mataram provavelmente centenas de milhares de índios nativos do Brasil. Na América do Sul inteira, estima-se que em 2 séculos podem ter morrido até 20 milhões de pessoas, da América até o Brasil. Mas quem imaginaria que nós estaremos falando em algo que é maior? Até seria legal ver todas as faces. Se alguém puder pôr todas as faces na minha tela, eu prefiro, viu? Porque é mais interessante falar vendo gente. Mas quem imaginaria que nós estaríamos falando hoje no dobro do número de vítimas comparadas com a Guerra do Paraguai, que durou 6 anos. 1864 a 1870, o Exército Brasileiro perdeu 50 mil soldados, 1/3 do Exército Imperial foi dizimado. Infelizmente, esse 1/3 de perdas de soldados do Brasil representaram 150 mil vítimas no Paraguai. 70% da população masculina adulta foi dizimada, algo que o Brasil nunca se desculpou, né, pelo genocídio que foi feito no Paraguai. Eu lamento profundamente isso. É algo que o Brasil tinha que, em algum momento, tomar uma posição, né, como outros países do mundo tomaram. Enfim, naquela guerra, 50 mil soldados e 15 mil civis morreram. 65 mil pessoas. Facilmente, nós vamos passar o dobro desse número em alguns dias. É a maior perda humana da história brasileira. Dificilmente ela vai ser comparada, ela vai ser equiparada. É apenas o começo. As previsões que o IRRD tem feito conosco, no Comitê Científico do Consórcio do Nordeste, previsões de outros colegas da USP, previsões do Instituto de Métrica e Avaliação de Saúde da Universidade de Washington, Estados Unidos, prevêem que até novembro, dia 1º de novembro, nós vamos ter 188 mil mortos no Brasil. E com essa previsão, se tudo se der como está sendo, que é um crescimento linear nesse momento dos óbitos no Brasil, aproximadamente 1.200 mortes por dia, 1.100, 1.200, nós vamos chegar a 200 mil óbitos no final do ano. E aí eu passo ao terceiro e último ponto. A nossa vida moderna, ela não começou, na minha opinião, com o método científico sendo introduzido por Galileu. Na realidade, a vida moderna começou com os pitagorianos do século VI antes antes de Cristo, que chegaram para a Grécia e falaram: tudo é números, ou tudo são números, os números são tudo. E no momento que um tal de Euclides, em Alexandria, alguns séculos depois, desenha uma reta e fala que aquela reta não veio da mente dele, de onde veio, a geometria veio daqui, a matemática veio daqui também, tá? Mas no momento que Euclides desenha uma reta e fala que essa é a descrição mais básica do mundo, do universo exterior, o mundo moderno nasceu, tá? Levou alguns séculos, porque os romanos vieram aí e destruíram tudo que os gregos fizeram, e nós precisamos dos árabes nos salvarem, lá em Córdoba e na Andaluzia, copiando todos os textos de Aristóteles, Platão, Sócrates, Euclides, em Bagdá, em Merv, na Ásia Central, porque se não fossem os muçulmanos do século 8 e 9, nós não teríamos nada da Grécia. O que sobrou em Bizâncio era muito pequeno, do ponto de vista da coleção da Biblioteca de Alexandria. Foram os grandes astrônomos, matemáticos e filósofos muçulmanos da Ásia Central, Bagdá e da Andaluzia, que salvaram a civilização ocidental, copiando os textos que depois foram traduzidos para o latim. Mas o Arthur Clarke dizia que se o Império Romano tivesse aparecido e dizimado Alexandria e os gregos teriam ido para a Lua no século XIII. A inovação dos gregos era tão dramática e tão sensacional, né, que nós teríamos pousado na Lua com alguém chamado, vamos lá, Angelakos, né, da ilha de Lesbos. Lesbos, de Mytilene, lá o parente meu, lá da ilha de Lesbos em Mytilene, né? Teria pousado na Lua. O nome não seria anglo-saxão, o nome seria grego. Enfim, o que eu quero dizer a vocês é que a terceira grande fragilidade é que pobre Platão, os pitagorianos estavam errados. Nem tudo é número. O cérebro que nós carregamos aqui não é computável. Ele não é computacional. Ele não pode ser reduzido a uma máquina de Turing. Esse é um teorema que eu e o meu querido amigo Ronald Sicurel, matemático suíço-egípcio, provamos há 3 anos atrás, na nossa monografia O Cérebro Relativístico. Esta camada de 1,5 kg de gelatina entre as nossas orelhas é um hipercomputador. Hipercomputador definido por Alan Turing. Qualquer máquina orgânica ou não que tenha capacidades computacionais acima de uma máquina de Turing foi considerada por Turing um hipercomputador. Então, a condição humana e os atributos mais fundamentais da condição humana, a empatia humana, a intuição, a criatividade, a inteligência, a nosso senso estético, a nossa capacidade de intuir, de descobrir, de minimizar um espaço multidimensional em poucas dimensões para conferir significado para o universo que está aqui fora, é uma função não computacional, do ponto de vista da definição de Turing. Nós temos aqui um grande armazenamento do que eu e Ronald Sicurel chamamos de informação godeliana, em homenagem a Kurt Gödel, que definiu um dos grandes, enormes limites da mente humana, que é o limite, no caso da aritmética, que existem verdades que são verdades, mas não podem ser definidas ou demonstradas formalmente dentro de um sistema formal como a aritmética. Eu e o Ronald advogamos a mesma tese em relação à mente humana. A mente humana jamais será reproduzida num computador digital e o comportamento humano jamais será reduzido a nenhum tipo de algoritmo e nenhum tipo de programa computacional, simplesmente que, por definição, ele é um sistema computacional analógico digital e, portanto, não reduzível a aquele maravilha, né, da máquina de Turing que rege a nossa vida. Então, eu queria terminar dizendo que, por causa dessa nossa imersão no mundo digital e por causa do fato que o cérebro humano é um grande camaleão que muda, né, a melhor definição da mente humana é de uma orquestra cujos instrumentos mudam a sua configuração física a cada nota produzida. A cada nota musical que o cérebro humano produz e emite para o universo, o retorno que o universo nos traz muda instantaneamente, não instantaneamente, mas em alguns milissegundos, a configuração física, microscópica das sinapses e das interações neurais. Por causa disso, a terceira fragilidade, e aí eu termino a minha apresentação, é que a nossa imersão nesse mundo pitagoriano, nesse mundo euclidiano, que é maravilhoso e que eu adoro e que eu vivo nele há 40 anos com o maior prazer, mas que não resume a experiência de vida humana, essa imersão digital está alterando a forma como a mente humana funciona. E nessa maneira, a neurociência talvez explique o porquê, num país como o nosso, que se vangloria de ser um país feliz, alegre, respeitoso ao grande hedonismo da vida, né? O país do carnaval, o país do futebol, o país do sorriso fácil, o país da mistura racial, só que não, o país né, de toda essa alegria humana. Como esse país consegue sofrer com imagens de Bérgamo, na Itália, em março, de todos os óbitos italianos, e não consegue ter 1 minuto para homenagear 100 mil mortos que falam português, que nasceram aqui, que são nossos vizinhos, que são nossos parentes, são pessoas que a gente conhece olhando pela janela. Da onde vem a falta de empatia brasileira? Daqui. Da mente coletiva que nós estamos construindo. Porque, se vocês não pararam para pensar, se eu olhar pela janela do meu apartamento aqui em Perdizes, em São Paulo, 100 mil mortos significa que numa área do meu bairro, Perdizes, de 6,5 quilômetros, se eu olhar pela janela, não sobrou nenhuma pessoa viva. se eu transferir esse número para o bairro de Perdizes, que tem aproximadamente 110 mil pessoas nesse momento, eu olharia pela minha janela num círculo que tem uma área de 6,5 km e eu não veria uma pessoa viva. Eu poderia repetir isso pelos bairros do Ipiranga, Moema, Jaçanã, Vila Maria, Tatuapé, bairros tradicionais da cidade de São Paulo. Se só sobrasse um indivíduo no bairro, ele olhasse pela janela, não haveria mais ninguém no raio que a vista alcança no horizonte. Eu não conheço a população de Boa Viagem, mas pode ser parecida com 100 mil pessoas. Imagine olhar pela janela de Boa Viagem, onde eu já fui várias vezes e passei momentos inesquecíveis da minha vida, e não vi ninguém. Essa é a Hiroshima brasileira. E nós ainda não nos demos conta. A ficha não caiu, porque a mente brasileira consegue ser empática com pessoas, e deveria ser, não estou de maneira nenhuma criticando, deveríamos ser empáticos com todo o sofrimento humano em qualquer lugar do planeta. E isso é fundamental para a sobrevivência da nossa espécie. Mas nós não conseguimos mais ser empáticos com as nossas próprias perdas. Quem explica isso não são os números, não são as projeções, não são os modelos matemáticos, não são os algoritmos. Quem explica isso é a transformação da mente humana no século XXI, que muito me apavora, como neurocientista. Porque ontem à noite, 2 noites atrás, eu li um trecho da Ilíada para terminar, e o trecho da Ilíada de Homero, do século XII a.C., que foi popularizada no século VIII a.C., e que virou o grande épico da sociedade ocidental, do mundo ocidental dito civilizado, quando Homero descrevia a morte de um soldado grego ou troiano no campo de batalha, ele levava um parágrafo para explicar o que aquilo significava do ponto de vista humano. A perda de uma vida anônima num campo de batalha. O soldado tinha nome, tinha pai, tinha mãe, tinha filho. Ele vinha de algum lugar, ele deixava algo. Cada morte na Ilíada, se vocês foram ler, eu leio a cada 10 anos, é a minha religião. A cada 10 anos eu leio a Ilíada e a Odisseia, e a cada 10 anos eu tenho uma interpretação diferente dela. Na última vez que eu li, a minha interpretação é essa. O que foi que nós perdemos nesses séculos todos, desde Homero até nós, em termos de não mais respeitar da devida forma o que é a perda de uma vida humana, não falemos de 100 mil, ok? Então eu deixo vocês com a definição mais homeriana que eu encontrei no Brasil da perda de uma vida, que foi essa semana com a perda de um líder tribal no Alto Xingu, aos 71 anos, alguém que era o líder do Xingu desde os 30, um dos maiores líderes, né, da história do Parque do Xingu. Quando perguntado aos membros da tribo, dos verdadeiros brasileiros, diga-se de passagem, ou os que estavam aqui antes dos colonizadores chegarem, os membros da tribo responderam: a perda do cacique não tem reparo. Porque é como se perdêssemos um livro da história da nossa civilização. Um livro que jamais será escrito novamente e que residia unicamente dentro da mente do nosso líder. Por isso, nós não perdemos uma pessoa. Nós perdemos um pedaço de nós, da nossa história. Multipliquemos isso por 100 mil e nós temos a noção da tragédia brasileira. Desculpe me estender demais, mas eu acho que era fundamental tecer esse raciocínio e deixar vocês com essa reflexão. Quantos livros foram fechados em 6 meses no Brasil? Quantos desses livros poderiam ainda estar abertos e ainda sendo escritos se nós tivéssemos manejado essa crise de uma maneira mais correta, mais profissional, mais científica e, acima de tudo, mais humana? Muito obrigado a vocês.
Professor, muito obrigada. Eu acho que de fato, isso explica muita coisa, né? A gente fica procurando muitas explicações nos números ou muitas explicações na origem do vírus, quando, na verdade, muitas dessas explicações, como o senhor disse, está aqui, né? Está aqui. Isso explica, inclusive, professor, como que o fenômeno da desinformação ganha força no mundo inteiro, e é algo que talvez tenha se transformado um vírus comum a todo mundo, assim como o coronavírus. Mas isso explica, por exemplo, muito... Esse é o meu objeto de pesquisa, é justamente a desinformação, e o meu objetivo, a partir de agora, é trabalhar com alfabetização mediática, ensinar as pessoas a enxergar os riscos, né? Especialmente professores, trazer isso para dentro da sala de aula, advogados, juristas, para que possam lidar com como a desinformação funciona. E um dos pilares da desinformação a gente costuma chamar de fake news, né? Mas as fake news, elas são apenas apenas um pedaço, digamos assim, um galho da árvore da desinformação. E a árvore da desinformação, ela se prevalece principalmente naquilo que as pessoas querem acreditar. Elas se prevalecem principalmente dos valores que as pessoas já têm, da confirmação dos valores que as pessoas já têm. Ora, se eu não quero acreditar, ou se eu quero acreditar que o vírus é uma invenção chinesa, eu vou procurar argumentos que confirmem isso que eu já quero acreditar, né? Se para mim é muito mais importante levar em consideração o que a religião, a minha religião, né, que compõe os meus valores como pessoa, como ser humano, se essas informações falsas, elas confirmam aquilo que eu acredito ou que eu quero que seja verdade, então o meu cérebro tem uma tendência muito grande de confirmar. Bom, isso é o que eu tenho estudado, e o senhor acabou de me dar, inclusive, muitas respostas sobre isso, que vai ajudar certamente no trabalho de muitos jornalistas, não só o meu, mas o de muitos jornalistas, mais especificamente nas pesquisas que eu tenho feito. Então, eu acho que, somando a isso, e só complementando um pouco do que o senhor trouxe, e muito obrigada por isso, a gente tem, além dos discursos adaptados ao que a gente quer ouvir, os recursos tecnológicos, né? Os robôs que fazem com que isso tenha um volume muito maior do que a realidade, na verdade, existe. E também a questão de como as pessoas, ao invés de argumentarem, trazerem argumentos técnicos, científicos ou históricos, elas simplesmente modificam os discursos, né? Isso tem acontecido, por exemplo, com muitos jornalistas. Ao invés de alguém responder uma questão de um jornalista, um questionamento sério de um jornalista, é muito mais fácil desmerecer esse jornalista, mexer com algo pessoal dele, né? Mexer com a sua índole, mexer com a sua capacidade, e aí você desvia o foco. Então, eu acho que o senhor acabou de responder muito do que a gente tem vivido em relação às fake news e ao fenômeno da desinformação, que definitivamente, né, faz parte desse vírus informacional que a gente tem vivido. Eu passo agora para o professor José Luiz, que tem, inclusive, acompanhado muito dessas dificuldades, né, professor, de fazer com que a informação chegue a quem realmente precisa de uma forma correta, de uma forma responsável, porque esse também é um dos papéis da comunicação, né? Ter responsabilidade com a informação que se passa. Em Manaus, por exemplo, eu percebi isso acontecendo de forma muito irresponsável, né? Se falando muito mais do que se queria que fosse verdade do que a verdade realmente. Professor Zé Luiz.
Não, excelente, excelente. E nos seus comentários. Nicolelis, você foi extraordinário, né? Você conseguiu colocar, né, em meia hora, né, toda uma evolução do universo associado ao nosso comportamento, né? Esse comportamento humano, né, ele talvez ocorresse de uma forma mais branda se a gente não tivesse encurtado tudo numa pandemia, né? E hoje a gente consegue observar esse comportamento, né, eu diria, em alguns casos, altamente exagerados, de pessoas que parece que não conseguem enxergar a própria realidade que vive, né? E você está correto, né? Eu tenho comentado muito com o Jones aqui, né, que as pessoas acham banal, né, morrer pessoas, né? As pessoas morrem, né? E o comportamento humano é muito curioso, né? Eu estava aqui lembrando, né, de um caso aqui em Pernambuco, né, de um jovem que teve que fazer um transplante de intestino e toda a comunidade se uniu para que ele fosse operado. Toda a comunidade. Isso aí realmente foi jornais, TVs, e salvar uma vida, extremamente importante. Toda a vida é extremamente importante. Mas o que é que ocorre? Às vezes, diariamente, morrem 70, 50 pessoas. E as pessoas, muitos nem usam máscara para proteger as outras. Né? Quer dizer, é uma fuga completa de uma realidade que muitas pessoas não conseguem viver com essa pressão. Nicolelis, você foi realmente extraordinário. Bom, eu lamento que você tem que sair agora.
Me chamou que nem louco. Eu queria agradecer, me desculpar com todos pela overlap dos horários aqui, né? E
Não,
só
claro,
falar,
claro.
Agradecer ao convite, né? E essa mensagem que a gente ouviu aqui, vocês dois falando, é exatamente isso. No momento, o cérebro cria modelos de realidade. Se algo vem e confirma um modelo que seja o mais estapafúrdio possível, o cérebro tende a aceitar isso imediatamente. Então é isso mesmo. Você cria um modelo de vida cheio de preconceitos, cheio de visões estapafúrdias, a Terra é plana, vamos dizer. E aí, se há qualquer informação que apelar para esse modelo confirmar, o cérebro humano tem a tendência de dizer, ok, isso aqui está confirmado, tá? Mas, de qualquer maneira, muito obrigado, me desculpem, me perdoem aí, e até uma próxima. Perry, nice to meet you, thank you very much, e até mais, então. Tchau.
Nicolelis, essa foi a primeira. Logo vai ter a segunda, a terceira e mais. Muito obrigado.
Tchau, então.
Pronto, passo a palavra para a Isly e depois para o Jones, para apresentar a PET. Muito obrigado.
Então, é impressionante como a gente tem percebido, eu tenho falado muito e ouvido muito, pesquisado muito sobre as questões relacionadas às fake news, né, e a desinformação de um modo geral. E todas essas explicações, toda essa fala, né, do professor Miguel, explica exatamente por que as fake news ganham tanta força, né? Por que é muito mais fácil acreditar naquilo que se quer acreditar do que naquilo que é verdade. Eu tenho visto muitos jornalistas sofrerem realmente, acho que a gente, enquanto jornalista, nunca sofreu tantos ataques, né? Por estarmos falando ou reproduzindo discursos necessários, duros, é verdade, eu reconheço que é muito duro. Nenhum de nós ficou imune a sentir medo, né, a sentir a preocupação, a ter medo de perder alguém querido, mas eu acho que é como a dor não é algo que faz com que você molde o seu comportamento para você evitar a dor. Poxa, se eu sei que se eu colocar o dedo no fogo queima, eu não vou colocar o dedo no fogo, então isso me protege de alguma forma. Então, o medo lhe protege de você tomar atitudes que possam arriscar a sua vida. É exatamente isso que a gente está vivendo agora, né? Então, eu acho que é muito importante a gente falar sobre como as pessoas precisam de alfabetização mediática, e num momento como esse, mais do que nunca, né? De entender que a mídia pode atrapalhar o conhecimento das pessoas sobre um assunto tão sério como esse que vocês vêm falando, pesquisando, trazendo informações e sendo muitas vezes, inclusive, criticados, né? Você está dizendo sobre isso, que vai acontecer, que não vai acontecer, certo, mas traga isso para você de uma forma em que isso molde suas atitudes, né? E seus compromissos. Professor, acho que o senhor pode, ou o professor Jones, podem apresentar agora a Perry para a gente, né? Para a gente ouvi-la também, direto lá de Londres.
Jones,
Zé, I will introduce. Yeah.
Oh, yes.
I am so suspicious, yeah, because I know Patty for several years, and I know her work in UCL. Her brilliant work is not a word, is real, brilliant. She is the director of the Center for Emergencies and Digital Health in UCL in Londres, and we met her in a conference in UCL with Jim Owen. Maybe he's watching here. His name is James Stewart on the audience. It's not Jim, but he's here. Thank you so much, Pat. For I know that your agenda is a lot of busy, but thank you so much to stay here and listen in Portuguese and stay with us. And Patty is our board of emergency response here, we listen all the things that she talks about because we are guided by her actions and our other scientists in the world. This is what we are doing here, and this is why IRRD and LIKA is so has so success in their results because we listen best. Pat Kostkova, thank you so much.
Thank you so much for such a warm introduction. It's my real pleasure to be here. Bom dias. Unfortunately, I have to speak English because my Portuguese is very, very limited, and my talk is scientific. But I am learning Portuguese in a lockdown. I started learning Portuguese, so maybe next year I can deliver my talk in Portuguese. So look forward to it. So I have a long collaboration with Pernambuco, with the University of Recife, and I work with LIKA, with Luiz, and Jonas, who spent a year sabbatical in London at UCL. So this has strengthened our collaboration. And I also work on a long-standing Zika project with colleagues from University of Pernambuco, from Computer Science Department, and also from Paraíba, from University of Campina Grande. So I have a long collaboration with Brazil. And fortunately enough, last year we were awarded a 3 years extension grant, which involves University of Sao Paulo, but also indirectly it involves University of Pernambuco and Paraíba. So we're going to collaborate with the northeast of Brazil for 3 more years, which is my real pleasure. In my talk, I'm going to give an overview of our research, going back about a decade. So we've been looking into digital public health and developing interventions, helping citizens and professionals around the globe, and also evaluating these interventions, apps, big data systems, serious games, in terms of how effective they are and how influential they are in terms of changing people's behavior, improving their knowledge, and improving communication of public health message. So when COVID started, we obviously summoned our resources to get involved in the fight against COVID. A lot of the expertise we've been building over the last decade in the UCL Center for Digital Public Health in Emergencies have been extremely useful. So I give you a bit of an overview of our old research, our existing projects, and also I will present our new work in COVID and our excellent collaboration with Pernambuco on COVID initiatives. And also, I would give a high-level overview of what IRDR department at UCL is doing in general in terms of combating the COVID pandemic. Okay, so you should be able to see my screen. Okay, so I'll walk you through several challenges, and we will start with how social media could be used for predicting pandemics. Well, not exactly this pandemic. We're going to step back a decade and look at the previous pandemics. And I'm sure you remember that the previous pandemics was the swine flu pandemics in 2009. Misinformation and fake news and kind of media interest in pandemics, epidemics, anything to do with diseases is a really popular thing for media coverage. It makes the headlines. The more deaths we have, the more the media are interested. And obviously, the more the media on the kind of less quality end of the spectrum, like Daily Express, Daily Mail in the UK, the more misinformation they are spreading, the better headlines and the better sales they have. So it's a responsibility of us as researchers, and it's also a responsibility of citizens to be very vigilant to media coverage around pandemics and epidemics, and making sure they verify the evidence and we join our sources and resources to combat the infodemia, which is like an information demia, like epidemiology, and also we combat fake news and don't trust information which is not evidence-based. which in Brazil, I think, is one of the leading countries, not just sadly enough in number of cases and deaths, but also in a absolutely uncontrolled misinformation and confusion through social media channels. And of course, the US and the Fox News is not doing actually much better job either. So it's our responsibility to identify this issue and try to fight it. So going back to the swine flu pandemic, we at the time looked at the novel social media channel called Twitter. Those days, presidents and corporations were not on Twitter. It was a bit of a kind of a teenager, a geeky channel in 2009. And people used to have to write RT manually when they want to retweet a tweet, right? Because there wasn't the interface to do it automatically those days. So we look at this novel Twitter 10 years ago and thinking, well, is there any chance we can use Twitter to predict the swine flu pandemics? And I'm going to show you a film developed by BMJ illustrating how social media could be put in help with fighting and predicting pandemics several weeks before the official surveillance information sources would know about the spike.
A single idea has the potential to change healthcare forever, and the UK has an impressive tradition of innovation that has transformed healthcare.
In countries where the government is suppressing free media, Twitter or any public-generated content on the internet and social networks could be an invaluable resource identifying possible infectious disease outbreaks.
Our final presenter is Dr. Patty Kostkova. She is going to talk about how e-health and social networks will improve global health by 2020.
I have a question for you. How many of you have got this device on you at the moment? Virtually everyone. So my talk will show you how we can make the use of our day-to-day communication device for improving our health.
As people and diseases travel the world, Europeans face an increasing range of threats from existing and new epidemics. Stockholm is where Europe's watchdog agency was set up.
We have come to the ECDC, the European Centre of Disease Prevention and Control, which has got remit to support European nations and member states in regular surveillance of infectious diseases and providing scientific advice.
Patty, this is our Hall of Fame. Here you have the infected mosquitoes during the chikungunya outbreak in Ravenna. This one was during the tsunami response in Banda Aceh, 2004. This is in Iraq during the avian influenza cases in 2006. This one was a hospital infection investigation in Russia, minus 24 degrees. Actually, the center was created after the SARS epidemic, where a member state realized that for such threats as SARS with a global scope, then there is a need to have some coordination at the EU level. In 2005, there was an outbreak of chikungunya, that funny tropical disease originating in Central Africa. So we decided to conduct a risk assessment because that's really what we've been created for. What's the risk for the EU if a situation emerges somewhere in the world? Everyone was convinced that indeed there was a risk for the EU to see some transmission occurring there. So then the preparedness group started working with the member state to make sure that if it happens, we have the capacity in the EU to diagnose it. Nobody was able to diagnose that disease in the EU because it never happened in the EU. Yeah. And then in August 2008, we had the confirmation by Italy that indeed the establishment of the local transmission in Emilia-Romagna had started. And it was exactly the story that our risk assessment showed. It was actually one guy coming back from India, meeting at the wrong time, the wrong mosquito, and starting a transmission. Ended up with more than 200 cases.
The spread of this disease from Italy was contained, and the ECDC learned about how to prevent future outbreaks of chikungunya. Early warning of epidemics is crucial, and that's why the team constantly monitors both medical reports and all the world's media. A daily meeting considers current threats.
On other news, there was an AWS from Belgium yesterday reporting an outbreak of measles in Ghent. We knew about this because it was on the media, at least, that there was this situation in Belgium. So they give a bit more details about this.
So we got it in the media before we got it from the national authorities.
A week before, I would say.
Last year was the worst year in a couple of years that we had in the EU for measles. And what you're saying is that this year, so far, it seems to be even worse. So.
Twitter allows you to tell the world, or at least the followers, what you do at the moment, what you had for breakfast, whether you had a shower, which talk you're attending, what happened at your work. So what about swine flu? We have done a study collecting all tweets containing the word flu. How many tweets containing this word do you think we have received? Any guess? 10, 20,000? Surprisingly enough, we received 3 million tweets from all over the world discussing some kind of aspect of the pandemic or forwarding some of these articles mentioning the influenza. So we look at these particular tweets and compare to what the surveillance data from GPs actually told us about number of cases in the UK last year. And the Twitter discussion slightly anticipated the surveillance reported data. So the Twitter discussions in this large quantity, even though with the noise, which is part of it, can actually predict the pandemic up to a week, in this case, before the official surveillance, which is important to know for the authorities, for preparedness, for organizations like WHO, ECDC.
The vast amount of data can indicate there is some kind of public concerns, and we can crowdsource the intelligence straight to those people who might be affected.
Prior to the internet, my concern was to get as much information as I could. Now that I have internet, my concern is to get, I wouldn't say as little as I can, but as relevant information as I can.
Yeah.
I do feel a little bit skeptical about using social media for early detection. I think it's definitely a tool or a development that we need to be following up very much in the way that you've been doing with your groundbreaking scientific work.
Don't you think investing into research into the social media, and not just Twitter, including blogs, any of this user-generated content on the web, and finding out technologically better adjusted methods?
Indeed, it could be great to get some students or interns and get a project, look at the threats, what Google gave us, what the tweets would give us, what Medicis and the media would give us.
What the blogs would give us.
We have a new increase of cases in the Sud province.
The beauty of Twitter was this was tapping into resource people are using anyway. People are using in their daily life to tell their friends. We are piggybacking on this daily process and capitalizing on this new way of communication and using it for public health purposes.
So I hope you enjoyed our excursion to the swine flu year, when at the time a novel social media resource, it was before fake news, was actually proven to be very useful with a great potential to predict the epidemics several weeks before the official surveillance sources knew about it. So moving on. Let's look at the work we have been doing in Brazil. Although it's looking at a different outbreak, the outbreak of a Zika virus, and working with those two universities, as I mentioned, in Pernambuco and Campina Grande. A lot of the technological means and the challenges are very similar with COVID or any other pandemics we will be facing in the future. So as obviously all of you know better, being I presume all from Northeast Brazil. Obviously, Zika is a vector-borne disease transmitted by mosquitoes, and the control of the mosquito populations in densely populated parts of the cities like Recife is critical to the success of decreasing the number of cases of Zika and also chikungunya and dengue fever transmitted by the same mosquito, the Aedes aegypti. So working with the local healthcare agents in the environmental agencies in Recife and Campina Grande, we developed a mobile mobile app, enabling the experts to collect the data from properties they're visiting in their daily jobs using a mobile technology, as opposed to using the old-fashioned paper-based format where they were recording which properties they visited and whether there were or were not mosquito infestation and how they destroyed the mosquito populations. So using the mobile phones, obviously, it's not just making it easier for the agents to record the information because it's immediately on their phone. They don't have to re-enter the information about the property address, etc. But also allows a real-time transmission of the data back to the public health and environmental agencies and also the municipalities who also are involved in the project in order to see where the potential mosquito hotspots are. And you can see the map of Recife with the districts, and then the red dots indicate where currently the agents are reporting a high occurrence of mosquitoes. So the managers who are in charge of it, or public health experts, can just look at the hotspot areas, and then can see exactly which properties have been identified as having the high risk or where the mosquitoes were found and destroyed. So look at the properties, that's it. So it's not just enabling a real-time communication and data exchange, which makes decision-making much faster and more accurate and more timely than without a mobile data communication. It also allows a real-time mapping for experts to understand where the data are reported and found from the work being done by the healthcare environmental agents. It also allows to involve this particular data source into prediction. So my team, in collaboration with our colleagues from Brazil, is looking into a development of predictive model where we're using these agent reported data through our mobile solution together with weather data and socioeconomic deprivation data and data about wildlife availability in various parts of Recife and the coastal part and all the way to the kind of inland part. So all those heterogeneous data sources are being brought together, and we also will be deploying Internet of Things devices in the water tanks and in people's gardens to get a real-time information from the IoT devices about the weather and about the water quality in those sample properties we will be looking at. And these real-time data sources will enable rapid real-time prediction of the likelihood of the high-risk hotspots for the mosquitoes, which then would allow the healthcare agents to go immediately into the high-risk areas and destroy the mosquitoes more effectively, faster, with much better accuracy than visiting properties in a kind of the usual cycle-based pattern they're using now. And obviously the implication is the better mosquitoes are controlled, the faster these new hotspots are destroyed, the better chances we have for the human population not to be infected. So that's really exciting project, and some of the technological solutions we have at UCL for the Zika projects we have quickly developed for our COVID project, which I will also show you at the end of my talk. So moving on, it's quite interesting to think about technology and apps in a sense of something which is kind of for healthcare professionals, where people collect data, they predict using data, they can use mobile phones and interventions to inform policymakers or inform citizens. But it's interesting to look at mobile phones and obviously web-based solutions as something which actually could be a game. And a serious game is like a computer game which is not for entertainment, not for fun, it's for something which has got a meaning or purpose. So it's an educational game which aims to communicate some learning objective, or which aims to educate the player about something in relation to his or her health. So although it is not specifically designed for COVID, our EBAC project, or edugamesforall.org, you can go on the website and have a play if you would like, has been teaching European children. It was a large EU-funded project in 10 countries in Europe, including Portuguese. So the games have been translated into Portuguese, so you can play in Brazil. And teaching children from primary and secondary schools the basics about microbes and basics about hand hygiene, and understanding how their body can be protected against diseases, and how we can fight fungi, bacteria, and viruses. So the kind of basic education, which in some countries is delivered as a part of biology lessons, in some countries was delivered as part of some social lessons about hand washing and kind of right behavior. We have harmonized a curriculum across Europe and developed these games for junior and senior children to better understand how biology works, how bacteria and viruses and fungi, how they differentiate and how they can protect themselves from becoming ill. So you can see like fungi, bacteria, and viruses. We have very talented artists. So they have been drawing these cartoonic images you can see here based on the actual shape of the microbe. And also the color coding was helping the kids to understand, and maybe some of them, they look really scary. They are not good for us because they make us ill. And something like penicillin may cure us. So the color coding was also developed to help to communicate the message about some bugs being good and some bugs being bad for us. Also, the kids were supposed to learn that, the microbes are just too small to be visible by an eye, but they feature everywhere. They could be inside our body. They could be in the kitchen. They could make our bread to go moldy. And they also could be on our skin. So hand washing is an important message to learn to protect us from getting an infection. So just to give you an example what the game looked like. So this is one of the levels in the junior game for the smaller children, where the avatar, this girl on a skateboard, is supposed to be pushing this Lucilactobacillus into a glass of milk. And if she does it 3 times, see what happens. It turns milk into a yogurt. So in this game, the kids were supposed to understand from the game mechanics itself that actually some bacteria are good for us, and we're using them to make things like yogurt or bread. So this learning objective actually has been the most successful in improving the children's knowledge when we evaluated the knowledge pre and post the game. Another learning objective is looking at how we can, when we get ill, we have this horrible purple infection in our body, how do we can use antibiotics to destroy the infection. And again, the learning objective was to explain the children that, yes, we can use antibiotics if prescribed by our doctor. But the important thing is to use the entire course, finish the antibiotics. Otherwise, we will be contributing to antibiotic resistance, a global phenomena which is threatening humankind as much as a global warming, which may result in the usual antibiotics no longer working in the near future. So the idea was for the player to be using antibiotics. You've got a full pocket of them, throwing it in this horrible purple infection. And then when the course was used, or when all antibiotics were used, then like a win. However, as you can say, she thinks she has destroyed it. It looks like it's all gone, but she still has some left. So what happens to the player? They will lose some points and the infection grows back. So only when she finishes the last one, the whole course has been used, then the player gets the points and can move on to the next challenge. So yeah, so the kids love playing the games, and we demonstrated how effective each of these learning objectives and the mechanics were in terms of communicating the message we were trying to teach through the learning objectives in the game. We also had a game for senior children. So if you go to the Games for All, edugamesforall.org.uk website, you can play a games for senior children, which is like a detective game where you investigate why an outbreak happened. You need to speak to the expert, you need to speak to the lab, get your samples tested. So it's like being a detective, just resolving not a murder, but an epidemiological crisis or epidemiological outbreak. So the kids loved it. Of course, who wouldn't love playing games at school as opposed to teaching from a textbook and a traditional lecturing? So it's been a very popular program, and since then it was translated into, was taken by ECDC and translated into all European languages. Well, one may think that, mobile game-based technology is just for children, right? Kids love playing games. There's a good way to teach them about their public health and improve their understanding of how body and diseases work. But it's not just for games. One of the most rewarding projects which we worked on in a couple of years at UCL is called Mantra. It was a project which aimed to be increasing the awareness and understanding of maternal and child health in rural Nepal, in women in rural Nepal. So a small, really low-income country in the Himalayas, where the majority of people live in rural areas with no access to traditional healthcare. They only are being visited by volunteers, women who are kind of supplementing the function of a primary care in Nepal. And they have meetings like this when they meet every month, and they discuss with those volunteers some public health issues, like how to look after their baby, about pregnancy, nutrition, and about farming. So these are kind of educational meetings where the women gather, had a bit of a chat, and then have some kind of educational component delivered by those female volunteers who kind of government provided to keep awareness of primary health and public health. So we work with a local stakeholder, local NGO called IRRD, who have got many government grants to improve maternal health across Nepal. And they have arranged to get contact with women who are meeting in those women's groups in a district called Kavre, south of Kathmandu, which was worst hit during the earthquake in 2014. So the game we were supposed to develop for these women was really challenging. It was to help them understand maternal health and neonatal health challenges, so how they would differentiate between something which is just normal and they wouldn't have to worry about it. They may be seen by a local nurse who may come, or this volunteer who may come once a week to their village, or if something is a really critical condition during pregnancy or during a birth, or once they have their neonatal baby with them, and they need to be immediately transported or sometimes even walk to the local health or hospital. So differentiating between high risk and low risk conditions was really important to address unfortunately, very high neonatal mortality in Nepal, and also very high, unfortunately, mother's death during delivery, during giving a baby. It also is part of the geohazards. Nepal is a country which unfortunately suffers a number of earthquakes, regular earthquakes. People are not just dying during the earthquakes, but also after the earthquakes. So in the devastating 2014 earthquakes, more people actually die afterwards because they have walked into cracks, fell into cracks, there were landslides, rock falls. And so improving understanding of the geohazards and how to navigate your way through the country after say, earthquake is also very important. So we have 3 modules: maternal, neonatal, and geohazards. And the challenging thing was many women in Nepal are having a very low educational level, less than 8 years. Some of them are even illiterate. So the game could not include any text, any instructions, anything which would be written in Nepalese, because they may not be able to understand it. Some of them have never used a smartphone. Phones are still a luxury in some parts of the world in a country like Nepal. So some of them use traditional kind of Nokia touch phones, and some of them just have never used any phone before, because if there's one phone in their household, it's a very traditional society. It's the man who keeps the phone, and the woman just can't use it quite often. So for some of these women, being given a top of the range smartphone, they didn't even know what to do with it. How do you touch it, and how do you move things around? It was a really challenging thing to actually start to teach them, how to use a touch screen and how to use drag and drop. So we took a picture of one of the village women with a baby in her arm, and then we have our artists have separated the baby from the mother, and they kind of tutorial to teach them how to use drag and drop was they have to get the baby and move it back into the mother's arm. So they played this little game, and it was their friend from the village. They loved kind of, seeing the baby and the mother who was their friend. And after a few minutes, they got it, and then they could play the game. So it was really amazing how quickly actually they have grasped it. And, there is no kind of technological barrier if people are given the opportunity, and if they have good resources to be able to access technology, and it could significantly improve their resilience, their health, and their knowledge. So just a quick example, the game have got the learning objectives. Everything was communicated using a picture. These pictures, the pictograms were iteratively consulted with the women in Nepal and the NGO in Kathmandu we work with to make sure they understood, this is a crack and you have to be careful crossing a crack, for example. You have to be careful walking around an edge of a rock because there could be a rock fall, or there could be a landslide and it could drag you down. And understanding which conditions is critical, like in this case, heavy bleeding during childbirth is a critical condition, and if women is delivering a baby at home, she should immediately be transported by an ambulance to a hospital. So they learn how to drag and drop and how to play the game. They got immediate feedback. So again, we consulted what is a positive and negative sound. So positive sound, the women in Nepal thought would be like listening to birds. So we could have audio, and when they answer the question right, we play this audio with the birds. And if they got it wrong, they got a cross, and the sound is a thunderstorm. So again, it's very nature-based sounds which communicate something being right or wrong, which immediately told them if they got it right or not, and they could change their mind in the next iteration of the game. They were getting points, but again, the points couldn't be in numbers because of the literacy issue. So they were getting these little leaves, and the flower was growing leaves, like the yellow one is growing loads of leaves, so it shows like the player was successful. And then at the end, when they finish the whole module, they get like a little flower up there, like you can see the purple one, and they could be collecting the purple ones, and they could move on in the game. So all the pictures and pictograms would develop with the local community to make sure it's understood, it's localized, and it's also, the color coding was also discussed with them. And we were really excited to see how much they enjoyed it and how much they actually learned from the game. So they have a number of learning objectives. We demonstrated an improvement of their knowledge before and after playing the game. And very interesting and kind of rewarding results from us were coming from the focus groups. Although we had obviously facilitators who were speaking in Nepalese with the women, when we got the transcription, it was amazing to see how many of them actually enjoyed playing it and didn't even want to stop playing it. They wanted to have another go and correct their incorrect answers. And they also were saying how much they actually understood. This is helping them to get better awareness of health for their baby and for themselves when they're pregnant, and it's very beneficial. So this has been quite a rewarding project to see how technology and digital health can help women in the most deprived parts of the world. And let's move on to Africa. So our other initiative is addressing the global issue of antibiotic resistance. In this case, we're not working with children. In this case, we work with professionals, with surgeons in Nigeria, with 2 hospitals in Lagos, in the capital, and 1 hospital in the Delta region, where we have got local partners, and we recruited surgeons to use our gamified app to increase compliance with prescribing using the mobile technology at the point of care. Well, so as a quick overview, obviously antibiotic resistance is a global issue, and like the figures look horrendous if it is not addressed, and we either don't develop new antibiotics or we do not slow down the process of resistance. It is predicted to cause 10 million deaths by 2050 and may cost the economy $66 trillion. So this is a really important issue. The global community, research funding bodies, and obviously professionals and the citizens take seriously and try to decrease overprescribing and inappropriate use of antibiotics. So, so you can see these are the kind of major causes of resistance. So the second one is patients not finishing their treatment. So this is exactly what we were trying to teach the children through the game when they were throwing the capsules onto the infection. However, the GATSTA project in Nigeria is looking at the first one. It's overprescribing of antibiotics. So giving antibiotics when they are not needed or giving them for longer than they are needed. So we have been using the WHO guidelines, and we have developed an app which was implementing the recommended prescription and length of prescriptions by WHO for all major surgeries and for high or low risk patients. So there were kind of a decision tree built into the app, and the professionals were just filling in the data when they were seeing a patient. So it was used at the point of care. It wasn't a kind of training program you would go to and then forget about it when you go back and see your patient. So in the surgery, the surgeon filled in the data about the patient and what prescription he or she was giving to the patient. And then we immediately give them a feedback. So green feedback was good. This is in compliance with WHO. This is what WHO recommends to be prescribed, or not, or nothing. Red feedback was negative. It seemed like the doctor decided to prescribe something different than WHO recommended, or it was decided to give something for longer than WHO recommended. So we were giving them a red feedback. And you can see this picture of a dog. So in serious persuasive games, the picture of so-called mentor is quite an important way of communicating graphically through some kind of figure of authority that there is a message you should take on board. So we were developing the picture of the mentor with our Nigerian colleagues. And we kind of gave them a number of different pictures. Our artists developed, pictures of male doctor and female doctor, and abstract pictures like prescription books. And also we included few animals. And surprisingly enough, after 2 hours long focus groups, they decided they actually love the dog. They want the mentor not to be a human doctor. They want the mentor to be a dog. But the dog has to be wearing a white coat, and the dog has to be wearing glasses, and also a stethoscope around his neck. So it was really amusing to see how kind of they took this idea on board and culturally adopted it and have chosen the dog to be the mentor in this Nigerian game. The app was evaluated over 6 months, last year, June until December. So we're now publishing the final data. We work in the 2 hospitals in Lagos. So this is the picture at the top and at the bottom. And this hospital on the right is the one in the Delta region. So we have 90 surgeons who were enrolled into the program, and they were using the app throughout the 6 months periods. And we actually demonstrated that 96 decisions about the risk of the procedure were changed as a result of the app. And about 10 to 15% of the decisions with antibiotic prescription was changed towards a correct antibiotic after the app gave them negative feedback, or they reduced the length of the prescription according to WHO. So there still wasn't a full compliance, but there was definitely a measured behavior prescription change towards a better compliance after using the app at the point of care. And this innovative project, because it's the first intervention where really, antibiotic stewardship and antibiotic prescribing is being improved and demonstrably getting better at the point of care using technology, was the project I have won the Innovator of the Year award in 2019. Obviously, thank you to my team in the UK and all the teams in Nigeria who were indispensable in developing the app through many focus groups, and also who kind enough used the app over 6 months period. So moving on to COVID. As I mentioned, having spent almost 20 years in the digital public health, it was kind of amazing to see how devastating pandemics we're living through now, and how unprepared we still are, despite all the technology, despite actually knowing how much preparedness needs to be put in place and management of the emergency. It's kind of really sad to see the number of cases and sadly number of deaths in many countries, and a very poor leadership in many countries, unfortunately, including the UK and including Brazil and the US in addressing and managing the pandemics and informing public and really empowering the experts seem to be a major issue. We have sprung our resources and look how we can quickly repurpose some of the resources we have been developing in other projects. And we have quickly launched a new project called My Lockdown Journal. It was to help people to manage the time when they're in a lockdown by recording their activities. So recording what they do, and if they do it on their own or with people on Zoom or online or face-to-face. It was lovely to see how quickly people adopted. They've been having obviously birthday parties online, and they've been having pub quizzes online. It's very popular in the UK to do pub quiz, and you can do it online. So a lot of things have changed, and our app is just kind of an intervention which is helping people to manage their time and have more of a sense of normality. They can go back what they have been actually doing, as opposed to kind of losing the track of days. And also it gives us invaluable data for public health authorities to know how citizens are adopting their lifestyle. You can see in the World Cloud, actually people have been really getting active. So a lot of people have been reporting they've been doing running or walking and cycling and exercising. from this study, we have collected about 5,000 responses, and the majority of people, 53%, was doing an exercise at least once a day. And the most popular was running, walking, and cycling. So that's a very important, a very positive shift. Also, a lot of people have been doing meditations and yoga and praying, again, most of them at least once a day. And sadly enough, it was seen that older people, 65 plus, have been coping with the lockdown and the whole changes much better than younger people. The younger people have been reporting that they have got mental health issues and they were stressed and irritated and they had a higher degree of anxiety. So there has been definitely a measurable generational gap between young and old and their response to this difficult period. We have also launched a competition on social media, so you're most welcome to take part. It's called My Lockdown Journal. You can follow our account on Twitter and Instagram. And if you post a picture of what you're doing, obviously not in lockdown anymore, but kind of in a social distancing period, we may have a second lockdown again in the autumn. So if you post a picture you've been doing, it could be a journal, it could be any activity you've been doing, it could be an inspiration for other people. And if you tag it with My Lockdown Journal, we're going to retweet it for you. And every week we choose the best activity, the best picture as the winner of the competition of most innovative or most creative My Lockdown Journal social media user. So you're welcome to join the competition anytime. And maybe your picture could be the winner next week. We also link this competition to the app. So those of us who are sharing it, they also can see the images of the activities in the app. So you can get the inspirational through the app as well as through social media itself. So download the app, it's My Lockdown Journal on Google, and do join the competition. So it's not just the Lockdown Journal. We also have been doing an amazing work in Brazil with our Brazilian partners. So UCL has reported the work we do with Northeast Brazil, with John Center with LIKA, and also the work we do with Professor Wellington and the Computer Science Department. So it's been really great to see how our existing, years-long collaboration has immediately brought fruit and has strengthened the work between LIKA and UCL in order to fight the pandemics in Brazil. Also, Professor Jim Jones and I have recorded a short videos for the citizens of Pernambuco and Brazil to reinforce the public health message. And they are also made available through the LIKA YouTube channel. So if you haven't watched it yet, do watch it. So as I mentioned, my center is based in an Institute of Risk and Disaster and Reduction at UCL, which is a very interdisciplinary department, bringing together experts from tsunami research and ice research, all the way to earthquakes and volcanoes, and also not just the natural disasters. We have experts looking at the humanity and migration issues, and experts looking at, obviously, the health and pandemics. So almost everyone from the department is from a different discipline. So if you bring it all together, you really have fantastic interdisciplinary expertise to address complex problems like pandemics, disasters, and epidemics. So our leading professor is David Alexander, and he has summarized kind of the work we do as a department and specifically his advice for the UK government. So David has been involved with advising the UK government and also writing in for media to stress the importance of planning an emergency. He's an author of a number of books on emergency planning for disasters. And some of the kind of issues he have highlighted, looking not just in the UK, but globally, is basically looking at, well, leadership is important. You cannot fight an epidemic without a strong political leadership. So if you have arrogant leaders, or if you have the denialists, like we have in countries like, UK and Brazil, then obviously this becomes a massive problem and causes needless death. Failing to consult experts. Again, some of the countries have absolutely failed to get the best experts on board. They have been even actively disabling experts from speaking up in public and getting space in media. This is a very ignorant decision which costs human lives. Also, David identified that, like indecisiveness or erratic decisions, like in the UK, there has been a massive delay in introducing the lockdown. In the UK, we have waited almost a month, even though Europe was all in lockdown. We still allow traveling. We still have been kind of in this denialist period. So indecisiveness and lack of attention is unfortunately something which is causing an enormous amount of lives. And obviously, are people favoring economic interests, or are they actually concerned about saving lives? And once some politicians sort of shape the questions, is it about saving the economy or saving lives? Then it is the wrong way of addressing the problem. Saving lives should always be the top priority. So yeah. An interesting thing that, all governments have got some kind of plans. They have plans for emergency. The UK had it as well, but no one ever reads it. And obviously making it happen and making it operational when something like this happens is a completely different matter. So what COVID has taught us as a humanity? Well, obviously access to healthcare is essential. We should be really working towards a universal healthcare access around the globe. Obviously, we also need to understand that there are richer and poorer nations. There are nations which are better or worse hit. So solidarity and welfare is also essential. And European Union has been launching a program to address a massive relief, economic relief across Europe, addressing exactly these kind of discrepancies between some countries being hit more than others. We also have to understand that freedom has its limit. People shouldn't be complaining about having to wear masks or having to social distance. This is something which is obviously affecting the individual rights, but is for the better good. And protecting environment in general and sort of understanding what we can do to prevent the next pandemics is really important. Okay, so to close my talks, I'd like to just mention that my team has been quite widely covered by media. We were fortunate enough to receive a number of prestigious prizes. BBC have been reporting about this children's book. You can see this Lucilactobacillus there. And also, as Jonas mentioned, last year I was awarded the Innovator of the Year award for the innovation in Nigeria with the GATSDA project. So the Center for Digital Public Health and Emergencies is, as I said, UCL Center, and you're most welcome to contact us on any of the contact details if you want to get involved. And I would like to thank you to all the team members from all the projects, both at UCL and obviously in all the countries where we work, in Brazil and in Nepal, in Nigeria. We have a new project in Africa. And without all these people around the globe and bringing the expertise and the talents together in the most creative interdisciplinary collaboration, no intervention, no public health success would ever happen. So my thanks go to all the colleagues around the globe, including our fantastic colleagues in Brazil. And I'm happy to take questions.
So thank you, Patty. It was very, very nice to hear from you, to know so many possibilities we do have, schools do have, governments do have, to make people be more conscient and build the path to make especially the children to go to a way of more consent in the information in the social media world. So thank you so much. Can we go to the questions? Professor Luiz and Jones, can we go?
Oh yes, eu can put that question.
Zé, please.
Some questions on the chat.
Yeah, well, Pat, it was fantastic, and well, there is one question here, right? I can answer that. Well, I can make a comment afterwards, right?
Great. So let's. What do you think about digital era? It's a parallel or observable universe? Tell us.
So sorry, do you want me to answer the question from Luiz about the privacy, or
Well, Henrique, he put the question on top of the screen, right? Can you answer that first, Patty?
Yeah.
Henrique, can you put back again? That's it. This one.
Yes. So excellent. So the question is addressing a very, very important topic. It's about data privacy and data protection using digital technology. So absolutely, I think we have kind of witnessed that while oil was the very precious commodity of 20th century, data, personal data, is the new oil. It's the commodity in 21st century, which, if not regulated, it can violate human rights and disclose our private information for profit, owned by a few IT giants. So I think what we really need to do is looking at how we can globally govern the data ownership and data sharing in order to protect the privacy of citizens and kind of shift the ownership of the data or potentially profit for using the data back to the citizens who generate the data. There will be no Facebook, no Twitter, no multi-billion company in Silicon Valley making massive profit from selling our data or using targeted promotion advertising. Unfortunately, even in political domain, which is undermining democracy, in health domain, which is spreading fake news about public health, if users were not sharing the data. So this is one of the major challenges which I think is in front of us, to rebalance this wealth generation opportunity of the data and shift it back into the hands of municipalities, public health bodies, and into citizens themselves, who may decide if they're willing to share the data, how they want to protect the data, and with whom they would be perhaps happy to make the data used, like researchers. So I think this is a big thing which still is very much unbalanced. I think we have also seen that a lot of citizens are becoming more aware about abuse of their data. And again, going back to the UK, as an example, there has been a lot of public mistrust in the NHS, in the government developed track and trace mobile app, because they did not initially adopt the kind of privacy preserving anonymous model and decentralized solutions where you can use a system which will contact trace people you have been in close contact. If you're positive, then you can identify these people and they could be self-isolating. The government initially wanted to collect the data into a centralized systems and use them for different purposes. So the mistrust and the kind of low uptake of this initial app was a result of people being worried how their data could be used or what purposes they could be misused for. So I think, introducing these systems with public trust in mind and honesty and clarity over how the data will be used and preserving individuals' privacy, I think are the absolutely core essential contexts.
Great. So I think you talk a little about the other question here too, about the protection of privacy and data of people. So it's very important too. But another question, another thing that I think it would be great for you to comment here is how social media can be both good and bad for protecting the health of people. The information is even so important as it is bad. It can be dangerous for the people. So how can we find the way to be balancing all of this?
Very good question. Again, it's not that the actual media is good or bad, it's how we use it and what we allow to make it used for, which determines if it's used for good purpose or if it's potentially misused for a bad purpose. And in the context of health, one of the good examples is obviously you can use the crowdsourcing on Twitter to predict pandemics like we did for the swine flu. So with no effort, with no cost, the healthcare authorities, just by using information which is in public domain, can know a couple of weeks before they should be preparing for a spike. Obviously, using Twitter to disseminate information is also important. You can immediately inform public about upcoming dangers, about vaccinations, about all these topics. You can use the social media. People are using, hours a day now as a channel to communicate public health or risk communication messages. Unfortunately, obviously, players who have got a commercial interest or some other interest are using it as well, and they're using it better. So, we did research I didn't include in this talk, at how misinformation around vaccination groups is using social media. And like the number of misinformation campaigns who must be responsible because they're developing videos, they are using celebrities to tweet about vaccination's danger, and they're discouraging citizens all over the globe from using vaccination. So some of these players are extremely active, and they're obviously using the free media to spread misinformation and fake news. Again, I think it goes back to the governance. These media channels are not well governed. We shouldn't be allowing lies to be, spread without any impunity through social media. And it is about public health messages and fake news, political fake news. We need to have governance systems where social media would be forced to shut down these accounts or take down the lies, where basically the media wouldn't be allowed to be used. And I think once we get to the system, and again, it's about regulating the social media giants, and some of them are more open to regulation. Like Twitter has agreed that they would not be promoting sort of racially connotated messages in Twitter or politically misleading messages. Facebook has refused to take down any political lies. So there must be a regulation where we would basically make this into a law and stop the misinformation, specifically in those two critical areas, democracy and health.
Excellent. I will talk a bit before Zé Luiz, because he is the doctor here, no, the physician. And the previous talk, Patty, Miguel talked about with us about the mind, how we can compute the environment in the digital world and the real world. He is working to show us that the numbers are not so real, and we need the social component to put in the mind of the people to understand the numbers. And you working on take the technology and put in the mind of the people the serious game of the things. It's brilliant. So how can you see this balance? That's the question that Isly did. How can you see the balance between the real world and the real reality and the reality by digital platforms? And how can you influence the real reality by the digital reality? How can you see this? And how why I am asking it? Because here in Brazil, we are living in a parallel reality. And the projects like yours are perfect to try to bring the people to the real reality. Gaming or answering thing. How can you see, and how can you, if you have the budget in Brazil, what do you can do to put the real reality inside the mind of the people? If you can thinking about or talking about.
Well, that's a really good question, Jos. Yeah, if I knew how to put, the reality in the minds of people, then, I would do it immediately. It's a challenge, right? So I think it's all about going to, firstly, understanding how people are learning about the reality. Do they trust the information they get? Why they believe fake news, right? So it's all about sort of education and awareness of information trust on the internet. And again, that's something which some countries have invested into, like Finland has got a school educational program teaching children about how to understand what is a fake news, how to stop sharing fake news, how to assess the quality of the information source. So they are much more aware that basically some people could be abusing the internet and lying, right? So that's why also the political system is much more robust, because of the public awareness of information misuse on the internet. So I think one thing is education of public, which again goes back to who's going to fund it. So, a government which actually wants to control the public is not going to fund an educational program to increase awareness of lying politicians on Twitter, right? So this has to be coming like from the, from external players or from sort of liberal movements to really improve. It's like improving literacy, basically. If you haven't got a literate population, you can much easily control people because they just haven't got the knowledge to assess what you are trying to suggest. So exactly the same with internet literacy. So I think that's one of the major issues which has been part of the miscommunication and misinformation in Brazil. A lot of people haven't got the resources and knowledge how to assess the fake news. And if the fake news come from the very top, then obviously they happen to believe it because for many people, the government is still the trusted source. So I think it's the communication issue. The other thing is how to change human attitudes and behavior. And again, this needs a psychological input, right? So just giving someone game and hoping they're gonna change their behavior. Yeah, we can demonstrate it in some limited examples, like the surgeons making decisions about prescriptions in Nigeria. But changing someone's behavior in a complex things like an epidemic, you would really need a combination of like clear messaging, people being incentivized to make the right choices, people being financially obviously helped. If they have to be, self-isolating and they would lose their income, then they obviously wouldn't do it. So the behavior has to have all the components, economical, social, cultural, political, public health, to actually get people understand, get the reality in their head, as you say, and change their behavior and sustainably keep the behavior for better. And I think trust in the government and trust in the authorities is the key. Again, going back to the UK, you may know that the Boris Johnson advisor Dominic Cummings has broke the rule about the lockdown. And like 3 months ago, he drove to his parents in Yorkshire, and he has taken his wife to a local castle, even though everyone was meant to be at home and only make essential journeys. So when this message was published in June by Guardian and other media, it was a public outcry. And especially today, I've seen a study from a different department at UCL demonstrating a dramatic loss of trust in the government handling the pandemics after this message about the government's aid breaking the rule and doing whatever he wanted to do while everyone was sacrificing at home was actually broken out. So the trust in the government also has to be underpinned by the government themselves doing what they are preaching to want us to do. So not one rule for them and one rule for us. It doesn't work.
Betty, excellent, actually. Really lovely now, the comment you've done. The games is fantastic, I wonder, what do I think, afterwards, right? What's going to happen after pandemic? Do you think more people is going to use this system? What they think the kids, now they are at home, right? And they play a lot, to use not just gaming, like in order to get information. And some stay with the parents watching TV. And on TV is a lot about fake news, right? In Brazil, you put the TV on, there are a lot of things. And the kids might think, why do people put a lot of fake news on TV, all right? And on the other hand, they have these games, they teach them that. It cannot go to the school soon, actually. Some countries open for the school, but they're going to stay another 1 or 2 months at home, right? Before to go back to the school. Mm-hmm. What do I think is going to happen afterwards? I'm saying next year, right? Well, even before to get the vaccine, don't know exactly going to get the vaccine for, some place, the kids have to go back to the school, and they're going to have this, maybe a little bit concern about what's the information got from TV, how we got from the games, and how the data is going to the government, how they're going to use that. What's your point of view about that? Yeah.
Again, that's a very interesting question. You really phrased it very well, Zé Luis. We're not going to have the vaccine too soon. It's going to be at least a year, maybe 2 years of this kind of very uncertain, rapidly changing period when we have to somehow continue with our lives. We can't keep everyone in lockdown. But as you say, the more we start going back to work, kids going back to school, the more obviously the behavior will be changed, and the more this mixed messaging will be important to combat. So I think, for children, obviously it depends on the school and on the parents. The kids are very influenced by their teachers and by their parents. So if kind of the internet education and the literacy I have described previously, if it's, something where the kids learn to understand that the TV in Brazil, many channels are private, and there is a private corporate interest in spreading fake news, right? So we are criticizing the BBC because they have not done always a good job, but at the same time, it is a public broadcaster with responsibility to be presenting a neutral, evidence-based quality news. And we're fortunate to have a BBC, which is funded by the government. So I think, this is something where we have to understand that in some countries, unfortunately, there isn't at the moment a neutral BBC level public broadcaster. And kids have to, from early age, be learned, just like in social media, they can see a lot of misinformation and fake news, and they should be aware of it. TV is even worse, because it is reaching out to, I think, wider generational spectrum of people than social media. So yeah, it should definitely be, again, regulated, and people should not be allowed to be spreading fake news on mass media channels. But back to data regulation and information quality regulation agenda, which have to be international. We cannot really rely on the governments to be enforcing it. It has to be international. And then that comes back to like a global governance challenges we all facing. And now with the political challenges in Brazil, US, UK, and with like now the COVID challenges, we see the outcome. We see how we can decimate the whole countries by giving a green light to misinformation through, as you said, TV and social media.
Para o professor Jones e o professor José Luiz, trazendo para a nossa realidade essa gamificação de informações aqui, isso poderia ajudar, por exemplo, o trabalho que vocês têm feito no LIKA-UFPE. I'm asking them if the things you showed us could help them here in Recife, in Brazil, to make people more conscious of the real problem we have. Jones e Zé Luiz.
I am talking in Portuguese for the people. Patty, we are finish our time here with 2 minutes, 3. And sim, Isly, eu acho, sim. Por isso que Patty faz parte do grupo desde. We have no budget to hire her, but one day we will. And we are working this with UNICEF and the other actors, Chess and Canon, to bring Patty to our inside building team. This is what we are doing now. A gente está trabalhando agora para tentar construir, trazer para lá o OK. It's a pleasure to have her OK. Yeah, to bring Patty to build with the guys here, like Tiago Massoni, Wellington. They working with her and they know how to build the things. And a gente pode, já tem os professores aqui da UFPE, e a gente pode construir isso juntos, sem dúvida nenhuma, e tentar resolver um pedaço do problema que Nicolelis apontou, que é, a gente está fugindo da realidade. Patty tools can bring it back to the reality. Like playing, this is a microbe, this is a bacteria, look, he's not so good, some of them are good, some of them are not. Eu acho que esse é o processo para a gente ir aprendendo. Esse que é o...
Não, excelente. Não, excelente, Jones. Eu estava aqui lembrando. Patty, just tell them, right, about the LIKA, right? The LIKA is as you know, the place, right? And you're doing interdisciplinary studies, and then to develop the way the people living. That's very important. It's why Isly is here, right? We put people from journalism, people from engineering area, from biomedicine, for physics people, for mathematician like John is here. Want to put all together and face the real target. I think you can improve the quality of living of people, right? Here already in LIKA, you got a group, the head of this group is Professor Rosalie Bellier, right? And she's working with gaming, right, for teaching people, right? And she, last week she had a paper published, in this area, right? So definitely, as John said, we're going to work very hard and you want to get some money to bring you here, right? Physically or by virtual way, right? and to put together with the Rosalie team, right, Ashley, is very important. She already has got some link with the people in New York University. So as you said, that's not for one country, right? It's a global thing. It's very thing. I always say, actually, one was in Japan a couple of years ago, and the guy asking me, where you come from? I said, from a small place called Earth. That's it. I'm not coming from exactly Recife. I come from Earth. It's the way we live in the global Earth. And the people have to have this interchange all the time, right? And you have done this. The example I've done in Nigeria, Nepal, in Brazil, it's fantastic, And to use that technology for the right thing, for the right people, to improve their quality of life, and actually it's fantastic when doing this. Viu, Isly? Ou seja, esse sistema que a gente está usando, né, e a ideia, né, de contactar com o PET, eu acho que é fantástico, né? Como eu falei, a Rosalina já vem trabalhando com o pessoal de Nova York, né? Tem outros grupos, né, da engenharia biomédica aqui da universidade, que o PET já conhece muito bem, né, como o John falou, né, de outra, que é o Wellington, um grupo realmente fantástico. Eu acho que quanto mais unirmos pessoas com áreas diferentes, mais a gente vai crescer, tá certo? E né, realmente, né, o que o Nicolelis falou, eu acho que quanto mais isolado você fica, mais fácil vai ser você ser contaminado. Quanto mais contaminado pelas pessoas de áreas diferentes, mais forte vocês ficam. Eu acho que é mais ou menos por aí, né, entendeu? Eu acho que isso vem funcionando, né? E eu acho que a gente vai ver muito mais isso no pós-pandemia, né? Quando a gente vai ver que alguns se isolaram, né? Eles foram mais frágeis para aceitar os fake news, aqueles ficaram mais juntos, foram mais fortes para não ter os fake news e ficaram mais fortes para fazer uma sociedade diferente. Eu não tenho dúvida, né? Eu não sei se tem mais alguma questão ou não, Isly, por favor.
Acho que estamos chegando ao fim, né? A gente viu aqui alguns comentários e algumas considerações, todo mundo gostou muito, foi muito relevante tudo que a gente ouviu, mas acho que o nosso tempo está se esgotando, né? Vamos partir. Então,
Thank you so much. Thank you so much, Patty, to stay with here since the beginning of the epidemic, of the pandemic here, and with your talks and consulting and everything, and for this class, master class of what you can combine the things, and your slides on your media things is the answer about that.
Fantastic.
It's not, there is no doubt about this. Thank you so much. Muito obrigado a todos que assistiram isso. Português improving fast. Yeah, one day we will have here. Dia a gente vai ter aqui traduções online para a gente quebrar mais essa barreira de traduções. Muito obrigado, Zé Luiz, muito obrigado, Isly, muito obrigado, Patty, e vamos juntos e separados.
Muito obrigada, senhora.
Isso. Ok, gente. Muito obrigado. Na próxima sexta-feira, às 10 horas, mais um webinar. Muito obrigado para todos.